wanted to make sure that we had a facility within Flint where parents could, where that was culturally sensitive. That's the first thing, culturally sensitive, that parents could definitely receive services for their children that are faced with autism and other behavior issues.
Yeah, I know that Dr. Carter is still with us. I don't know, Rashad, if you can get her shot back up, because I wanted to ask her uh, what she is thinking, and tell me, Rashad, if this can be done. Uh, if not, let me know. But I want to ask Dr. Carter, having listened to these parents and grandmother talk so passionately about their own experiences, you know, are things getting better? I guess is what I've got to ask you. Being one of the nation's leading researchers, are we doing better?
I wish I could say yes. I mean, I think the pandemic has exposed, all kinds of challenges. And the pandemic has also exposed additional levels and layers of systemic racism. And I think that, as early intervention, which I'm best positioned to speak about, has gone remote, you know, further disparities in racial and ethnic minorities in terms of access to stable Wi-Fi, access to, technology, all of this, I think, has really challenged our systems. And, there's both implicit and explicit biases in decision making about who's going to be able to manage technology and decision, from the provider side. So, I think we have these programs that are proof of concept, like, Dr. Constantino's program, our work, several, we could name, handfuls of projects that show that actually we can do better. But I think broadly, we are not doing better yet. The stories are heartbreaking, and the fact that families are willing to come forward and tell their stories is heartening, and you should all be intensely proud of your bravery and, passion. But, we need to do way better. Like we really need to do way better.
Yeah. Thank you for your honesty, because obviously we can't fix what we don't acknowledge. And that's why we needed to have this conversation this morning, is because uh, scientists are beginning to acknowledge structural racism and to call it out for what it is, because
Yeah,
we
and,
don't
and I
know as Black parents that it was there.
absolutely, and it's like the limited willingness to invest in our kids early and in parents raising young kids early is so short-sighted, because we know when we invest early, we save long term. If kids are going to develop intellectual disabilities, they are going to contribute to the tax base less. If kids are going to develop into independent, working adults, they're going to be contributing to the tax base more. And we really just need to make those early investments, which are going to be huge. They're going to be really big, but they will over time, pay themselves back.
Yeah, absolutely. Well, we've got to leave it there. Thank you so much, Professor Carter, for staying on and for answering those questions.
My
Dana,
pleasure.
Larry, Catrina, you guys, as Professor Carter said, you all are angels. You are uh,
Mhm.
showing the world that there are Black parents out there, that we are standing up for our kids. We're fighting for our kids. We are united in this fight for our kids. And by just telling your stories, you just don't know who you're going to touch, and what parent is sitting at home right now, like you, Patrice, maybe in denial. And she said, I saw this lady named Patrice on this show called The Special Report, and she had the courage to step up and step into her son's diagnosis. And so now I think I'm going to make that call. And that's how it happens. We are often influenced by the people in our circles. And sometimes those circles are people that we meet on the internet. So again, thank you all for your advocacy, and good luck to all of you with your beautiful, beautiful kids. And again, thank you, Dr. Carter,
Yeah.
for your work. All right, we are moving on. We're talking about getting our kids back to school. Dr. Carter mentioned the systemic uh, issues that exist in terms of this virtual world that we're in, and we know there could be no more systemic issues than those related to getting kids back to school, particularly kids with special needs. So my next guest is the superintendent of schools for the Greenburgh Central School District in upstate New York. Her name is Dr. Tahira DuPree Chase. She's been on the show before, and I want to welcome you back, Dr. Chase. I know you are also a mother, so all of us wear so many hats. You're a mother, you're an educator, you are a superintendent of an entire school district. So I wanted to have you on today because I want to talk about these CDC guidelines that just came out about how we get kids back to school safely. What are your thoughts about the new guidelines?
Well, I think the topic of opening schools has been politicized, unfortunately. When we are talking about opening schools, we really have to take into consideration how do we do this safely and how do we do this responsibly? Most schools, when you think about most schools, a lot of our schools are old. They lack the ventilation that's appropriate to house students for a longer period of time. The CDC guidelines also speaks to the continuation of social distancing. Many of our classrooms are small, which means we can't bring all the children back at the same time because we will not be able to adhere to those social distancing guidelines. While I am a strong proponent for bringing students back because our kids definitely need to be in school, I am watching firsthand students are becoming more stressed. I am watching students fall into depression. I'm watching students regress. And I believe that students need to come back, but I think that we have to do this carefully and we have to be sure that we're doing this responsibly. Otherwise, we will find ourselves in the same situation we were in March, having to close school again because we're jumping the gun too soon.
Well, as it relates to special needs kids, Dr. Chase, is it even realistic to think that you're going to get special needs kids to socially distance and wear a mask throughout the school day? Is that a realistic expectation?
Absolutely, it's a realistic expectation. And I'll tell you how, Areva. In my school district here in Greenburgh Central School District, we prioritize bringing our special needs students back. We are in a hybrid model. And for those of you who may not understand what a hybrid model is, it simply means that we bring half of our population back 1 week while that other group is engaged in remote learning, and then we reverse it the following week. But for our students with special needs, our most vulnerable students, we decided to bring them in every day. They do not participate in the hybrid. We understood their needs were so drastic that these kids needed to be in person with their teachers, receiving their related services. With that, we have trained the students, and it wasn't easy. I'm not going to be the first one to tell you that it was easy, but we've trained the students to adhere to those social distancing guidelines. We set up routines to keep the children engaged in carefully washing their hands routinely, maintaining the mask, and following all of the requirements to ensure that they have a safe learning environment. It was not easy, but it took work and it took dedication. It also took high expectations for students. We set the bar high and the students met the challenge.
And I'm really, congratulations to you. Glad to hear that you've been able to figure that out. But I read a report that said that 40% of kids in special education hadn't received any support at all, and 20%, only 20% had received the services that they were entitled to under their IEPs. So are we leaving behind special needs kids, as a whole, as we think about how to educate kids in the pandemic?
So I want to be the first to acknowledge I have not perfected this. By no means have I. There's still work to be done at the Greenburgh Central School District, but what we did was we prioritized. I know as a nation, we are definitely leaving behind students with special needs. I am more so concerned with students who live in urban areas and underrepresented populations. These students, some still do not have electronic devices to even access the learning. Many of our schools have provided related services remotely. So if students do not have the devices to receive this special service, then it's not happening. Parents have to work, so they cannot actually provide it. It is unfortunate to hear that so many parents are not adequately and appropriately trained to do these types of services at home when it's typically given by a teacher. One of the things that I'd like to see happen in our nation's schools, it's something that we're developing here at Greenburgh Central School District, is revising those IEPs so that it is a COVID component to it. Here's my case in point. So suppose a student's IEP reads that a student in 6 months will learn how to climb the steps.
Hmm.
Well, Areva, you know that many of our children live in apartment homes. They may live in public housing. They may live in environments where there aren't any steps. So
Yeah.
how could you meet those IEP needs at home? So if you revise those IEPs and it's a COVID-related IEP, when this is an addendum to it, perhaps there are tools and maybe there are appliances and equipment at home that students can use where they're still building those muscles as it relates to the IEP, but you're not calling it steps, right? Because the IEP locks you into a particular set of guidelines and practices that you have to adhere. Because we're COVID, we have to be flexible so that we can still meet the needs of our special needs students, but we do it at home and we do it differently.
And that's really good advice. And I hope all the parents that are watching will do that, will reach out to their schools and say, we need to do an addendum and we need to make that addendum one that makes sense in light of the pandemic. I want to ask you, Dr. Chase, about this big debate that's going on about teachers and vaccinations.
Sure.
So the president, the vice president, the union leader for teachers, everybody's been talking about the vaccinations because the CDC guidelines do not say that returning to school requires teachers to be vaccinated. Do you think that's a mistake?
Well, here's what I believe. I believe that the vaccination will help us to decrease the spread in the schools. Many of our teachers' unions believe in that as well. I think that part of the anxieties that are attached to reopening schools is that there isn't enough vaccinations for our teachers. And so I think that if we make sure that we prioritize teachers as first responders, which they are, and if we prioritize teachers in getting the vaccinations, I think that it will decrease some of the anxieties and some of the angst that are attached to reopening schools for our staff. We need our teachers to be not only vaccinated, but we also need our teachers to be comfortable knowing that they're coming into the schools and they're going to give their best shot at educating our children.
So you've been back and you said this hybrid model. So you've had students on your campus, you've had teachers, you've had staff on your campus. What percentage of those adults on your campus have been vaccinated?
Thus far, we have maybe about 20 to 25% of our staff who've been vaccinated. In New York, we've had some issues with supply and demand here in New York. That has been widely publicized. And I believe that once New York gets back on track, it is with hope that by the time we open school in September, that we will have the majority of our staff vaccinated.
Do you think once that process is back on track, or just kind of nationally, do you think within that teacher population that special needs teachers should be prioritized even over general ed teachers?
I think all teachers are teachers of special needs. And I think that if we're going to really prioritize what special needs children should have, I think we have to prioritize all teachers getting the vaccination and not necessarily singling out special needs teachers. You never know when you may have to call your general ed teacher to come into a classroom to provide instruction or maybe even training for your special needs. So I would not like to see that divide among our teaching staff. I'd like to see a level playing field so that there's equitable distribution of vaccination.
What do schools do? Kids have lost tremendous amount of instructional learning time. They've lost, a lot of kids, a lot of their related services, that speech therapy, occupational therapy, behavior therapy. A lot of it just isn't happening, even with my own son. The delivery of that service model has been so upended and disrupted by the pandemic. How are schools going to compensate families and kids in particular who've lost all of those services?
Schools have to prioritize their budgets. They have to prioritize those resources to ensure that your most vulnerable children, your children with special needs, those kids who have those related services, who have missed invaluable instruction time, related services time, that it's provided the minute we start our summer programs. Start it early, provide Saturday academies, provide after school time so that students will have that opportunity to make up lost work. I personally believe that kids can spring back. Kids are resilient, kids are perseverant. When it comes to children with special needs, however, I think we're going to have to spend a little bit more time in identifying those skill sets that students have lost, be it speech, be it the ability to hold a pencil, the ability to hold a cup, chewing. There's so many other sensory factors that go into students with special needs, and we need to reevaluate what was lost, prioritize how we could help students to regain those skills, and then how could we take what kids are really good at and what they already know and expand upon it when we open school fully in the fall.
And finally, Dr. Chase, I'll ask you the question we've been talking about is race and these new studies that have called out structural racism as it relates to the diagnosis of autism in particular and the delivery of service or access to service. As an educator and as a mother of a son on the spectrum, what do you think the single most important thing that we can do as a nation to address these issues of structural racism as it relates to autism?
Funding. At the end of the day, Areva, it's funding. It is
Okay.
funding. So let me just share a little bit. And you're right. I am a mom. I have a son on the spectrum. As a mom, as an educator, what I can provide my son, the ordinary families cannot provide. I heard Larry speak earlier. He's an educator, right? Larry's the secret weapon when his wife goes to IEP meetings. When I go to those meetings, the meeting team, the
The
IEP
dynamic changes,
has a
right?
totally different attitude with me, right? And I understand that, and I'm grateful for that. But what I want for other children, what I want for my son, I want for other children as well. And unfortunately, it's not happening. There is a bill for $12 billion for students with disabilities. It was presented to the Senate in the summer. It was presented in the House in October. It has stalled. We need the funding here at the schools so that we can address the needs of those students. Students have lost anywhere between 9 to 13 months of instruction. Those kids have needs. When it comes to students with special needs, that gap is even wider, Areva. So it has stalled, and we're hoping that with Dr. Jill Biden as an educator and with Joe Biden, that we can possibly fully fund IDEA as it was promised to us 50 years ago, the 40% of what children need. That is our hope. Schools, especially with schools in urban areas, schools that represent students of color, they need teachers with intense training on how to provide the services that children need, how to provide for lost time. That training needs to also include cultural sensitive matters, because there is a cultural sensitivity that some teachers may lack when it comes to students with special needs. Many of our children of color have faced trauma during COVID-19, during this pandemic. They've lost family members, their families have lost homes, have lost their jobs. And so that trauma-informed instruction has to be infused in that training. Moreover, it is important that we empower families and that we empower our parents so that they can be partners in educating children with special needs. We never know when we may have another crisis and we may have to close schools. We want parents to know exactly what to do with their children should this school not be an option for whatever reason. And we have to empower those parents by providing intense training. But the funding is fundamental and is key.
Take off your educator's hat for a
It's
moment
2 o'clock.
and tell us, as a parent, you walk into an IEP meeting, you're not Superintendent Dr. Chase. You're just a Black woman with a Black son trying to get services. What's the one thing you say to a school district that looks at you and sums you up and decides that you are somehow unequal, unworthy of the same treatment that they would give to a white woman that walked in with a kid?
Parents know what their children need and they know what their children want. Parents are the biggest advocates. It happens. It happens to families. I'll be honest with you, it happens to me. I don't reveal who I am until later on because I want to see the experience. I want to see the other side. And then when it is discovered that I am an educator, that I am a Dr. Chase, I do see a difference in treatment as to what is provided to my son and even how I am addressed. It is really unfortunate that those disparities exist. It's really unfortunate that it exists in areas where children are underrepresented and underserved. We have to do a better job at providing training to individuals who are working with those underserved populations, and so that they can level the playing field when it comes to providing services for children and resources for families.
Well, we've got to leave it there. Thank you so much, Dr. Chase. Always a pleasure to sit down with you. You always have such, insightful things to say, and This is such a big topic. We come back to it periodically because there's so many families in need. And as this debate is going on the national scene in terms of how do we get special needs kids back to school, I think a lot of parents are confused. A lot of parents are frustrated and not really certain about whether they should even send their kids back to school when the opportunity does present itself. So thank you for helping us make better sense of what that process should look like and how school districts like yours can do it and can do it safely. And the bottom line is money. So thank you for bringing that up because we all need to know that, and we can talk to our senators, our Congress people, and make sure that rescue bill gets passed and gets signed by President Biden so we can get the money into the hands of those schools that are serving our kids. So again, thank you for joining me this morning.
Thank you for having us. Thank you. Thank you for providing this platform for such a great discussion.
Okay, wonderful. I want to thank all of my guests and thanks to all of you for joining us. Such a critical conversation about race, about kids with special needs, about getting our kids back to school. You heard Dr. Carter say, if we make the investment today in our kids, we will reap tremendous benefits in the future. Our kids can go on and have great careers. They can become taxpayers. They can become valuable members of our society. So make that investment today because these are the future leaders of this country. I want to give a big shout out to Angela Nichols. She was one of the original producers on the show. She has been with us for the last 2 weeks as we've been tackling these really big controversial topics around race. She goes off to another show starting Monday, but I want to thank her for lending her brilliance and coming back with us and let her know that she's welcome anytime at the Special Report. A couple of words to live by before I get out. It's never too late to do the right thing. My son's Marty's diagnosis shook me to my core. I struggled like so many other parents. I wasn't a Reva the civil rights lawyer or a Reva the Harvard graduate. I was just a Reva the mom with a kid with a diagnosis, and I couldn't get out of bed some days. I was so devastated by the diagnosis. I had to move from that place of anguish to get to a place of advocacy like so many other parents have had to do. It shouldn't be this hard. Shouldn't be this hard. You shouldn't have to have a bunch of degrees behind your name. You shouldn't have a big title or a big job to be able to get services for your kid. The color of your skin should not dictate the quality and the timing of the services that you get for your kids. Black and brown kids should not have to wait years for diagnosis and treatment after their parents have made their physicians and medical practitioners aware of their issues. You heard Dr. Chase say, we know our kids. So when we tell you something is going on with our kids, listen to us. We are not dumb. We are not stupid. We're not any of those stereotypes that you may have heard of. We are smart. We are intelligent. And it doesn't mean that we have to have a degree to prove our intelligence. We know our kids. Listen to us. No doubt, as Dr. Chase also said, this is hard work. It's going to take a lot of hard work to eliminate the inequities in autism diagnosis. It's going to be hard. It's complex, but change is doable. This country, with all of its resources, has the ability to address these structural drivers of inequity, these drivers that are creating these barriers to equitable care. It has the capacity to create a diverse workforce, to make diagnoses and services affordable and available in every Black and brown community in this country. And so bravo to the parents that you saw this morning and to the men and women that work at organizations like Revive Community Health Center and the men and women that work at Special Needs Network, which I created after my own son's diagnosis. I'm so honored that I get to work with such incredible advocates and men and women who are putting boots on the ground and working with a sense of urgency and purpose to address these inequities. The alarm bells have been rung. The evidence is indisputable. The only question left to be answered, this is the only question, is does the autism and healthcare community have the will to do the right thing by Black and brown kids? So far, the answer has been a hard no, but in the words of the late Nelson Mandela, it always seems impossible until it's done. And knowing autism parents the way I do, I know we won't stop until we prove that it's possible. I'm out, y'all. Be safe out there. Don't forget to wear your mask, and don't forget, we are all in this together.